A bill that would expand control for parents to make medical decisions for their children and broaden vaccine exemptions. Thank you for staying up with us tonight at 11. I'm Anthony Austin.
And I'm Heather Crawford. So that bill is now moving through the Florida Senate, and our Christina Burgess joined us. And Christina, you had a chance to speak with the state senator who introduced this bill, as well as medical experts who have some concerns.
Yeah, Heather and Anthony, the bill was introduced last week by State Senator Clay Yarborough and focuses on expanding parents' rights when it comes to vaccines and medical treatment for their children. Now, supporters say it empowers families to make informed decisions, while critics warn it could lead to lower vaccination rates and lead to outbreaks. Senate Bill 1756, also known as the Medical Freedom Act, is advancing through the Florida Senate. It would expand parental rights related to vaccines and medical treatment. The bill was introduced by State Senator Clay Yarborough of Jacksonville. Under this legislation, healthcare providers would be required to give parents information about vaccine risk, benefits, and safety before administering vaccines to children.
Parents need to be in the driver's seat with regard to their children's education, with regard to their well-being, with regard to their health care, which is what this relates to. And this really is making sure that parents continue to be empowered.
The bill would also expand parents' ability to waive mandatory childhood vaccines through conscience-based exemption. The senator acknowledged similar exemption policies in states like Idaho and Arkansas.
There could be an individual out there who maybe their religious belief does not compel them to not want their child to be vaccinated. Maybe it is a matter of philosophy or conscience.
Medical experts say while informed consent is important, declining vaccination rates could have consequences.
I don't think you should take away information from parents. I think you should absolutely tell the parents everything they need to know. But when you give them a choice and they don't quite understand the implications of choosing no, not only for their child, but for the entire community, I think you're doing a disservice from a public health perspective.
This legislation comes as measles cases are being reported across Florida. The CDC reports 6 total cases this year in the state. Baptist Health confirmed 2 pediatric cases this month.
Right now, I know we have some, here on the First Coast, which we're monitoring. My office is monitoring that too and staying abreast of all of that.
Senate Bill 1756 also would allow pharmacists to provide ivermectin to adults over the counter without a prescription. Yarborough says it helped treat people during COVID, despite FDA warnings against its use for COVID-19. And this bill passed the Health Policy Committee this week and has to pass 2 more committees before it could go to the full Senate. A companion bill has been filed in the House.